The first piece is truly having a pediatric oncologist. And for children, for the young children, that's not that big a deal, so to speak, just because most adult oncologists won't take care of a 3-year-old. It's not appropriate, and they know that. And so, they'll refer those patients to us. So once you have your pediatric oncologist, are you at a center where they do have surgeons who feel comfortable with big surgeries, if that's going to be part of your care, who can put in central lines, that sort of thing? Is there an intensive care unit available? So if your child gets very sick from the side effects of chemotherapy or from the tumor itself, is there appropriate care available, again, who are used to taking care of sick children, who know the nuances of also the immunocompromised patient, a patient who's undergoing chemotherapy, that sort of thing. Some people live in areas where you don't have that available, and so you may have a pediatric oncologist who is doing a great job, but maybe it's a smaller center, so they don't have a surgeon, and that's okay. I think the other thing that's important is making sure that the people that you work with understand their limitations and know that, you know what, this is a very specialized thing, this is a rare tumor, so we're going to talk to somebody at a larger center. And the beauty and one of the nice parts about pediatric oncology is that we work as a consortium across the country. So we're all part of a group called the Children's Oncology Group, and most importantly, we share information with each other. So ask about the side effects, ask about, will most of our therapy be in the hospital or will it be in the clinic? Where will we be for most of our therapy? Will my child be able to go back to school during therapy, or do you recommend that they do homeschooling for the course of therapy and then can go back to school afterwards? Are there any physical limitations? Sometimes based on where a tumor is, it's important that they don't do contact sports, or they don't horse around too much, that sort of thing. And so asking about that's important. You're never gonna know as much as you want to know, particularly in the beginning. It takes time. Nobody that you're dealing with expects you to understand everything at the beginning. Nobody expects you to remember most of what we say. We know that we're going to repeat things over and over again. We want you to ask the same question 3 or 4 times because it lets us know that you're trying to absorb it, and it's just not there, and that's okay. But that, our goal is what's best for your child.